Today, we're digging into a hidden crisis in our healthcare system. It's about the absolutely staggering cost of becoming a doctor and why, believe it or not, you, the patient, might be the one who ends up paying the price. So let's just start with a question that might sound a little extreme, maybe even crazy. What if the biggest thing affecting your medical care isn't your doctor's expertise or the latest tech, but something way more personal to them, their debt? To really get our heads around this, we have to look at a problem that you won't find in any medical textbook. Think of it as a kind of hidden diagnosis, one that's affecting the healers themselves. Okay, I want you to picture someone in your mind, a brand new doctor just out of med school, totally ready to change the world. This doctor is everything you'd hope for, right? They're brilliant, deeply compassionate, and they are absolutely driven by a real desire to help people. They got into this for all the right reasons. But here's the thing. Underneath that white coat, this doctor we're picturing is carrying a silent, incredibly heavy burden that they really can't talk about with their patients. And that burden? It's a mountain of student debt. We're talking often over $200,000. This creates a whole new reality where the clock isn't just ticking for their patients, it's ticking on these massive monthly loan payments. And this, right here, is where the trouble begins. So let's jump to our next section and really see how this burden directly messes with the practice of medicine and, well, the care that all of us get. So what happens when this immense financial pressure collides with the ideals of medicine? Well, the whole equation gets thrown off balance. The focus can slowly shift from what's truly best for this patient to what's absolutely necessary for me to survive financially. And the consequence of that is just deeply troubling. When time is literally money, appointments get shorter and decisions get rushed, all of a sudden that really crucial human connection, empathy, can feel like a luxury that the system just can't afford. This all leads to a model of seeing huge numbers of patients, what feels like assembly line medicine. And what the system might call efficiency is often just, for the doctor, burnout in disguise. Now, this pressure on an individual doctor doesn't just stay with them, it scales up. And it starts to change the very fabric of our healthcare system. Let's unpack that transformation. You see, when the goal shifts to seeing as many patients as physically possible just to cover debt, healthcare stops being about care. It starts becoming about throughput. And patients, we risk becoming just another number to be processed. And the consequences for us, the patients, are very, very real. In a system that's optimized for speed, medical errors can go up. That vital connection between you and your doctor gets weaker, trust starts to erode. And look, this isn't a failure of the doctor, it's a failure of the system they're forced to work in. We should put a name to this whole thing, the hidden tax of medical debt. It's basically a system where financial pressures are so intense that they actually begin to shape clinical decisions. It creates this silent, unspoken conflict where the doctor's survival is competing with the patient's care. Now, it is so important to understand that this isn't just a collection of individual stories or some problem for the medical profession to solve on its own. It is so much bigger than that. When the very systems designed to keep us healthy are pushing our healers to their breaking points, it stops being a personal issue for doctors. It becomes a full-blown public health crisis. And just look at how this all cascades. Doctor burnout and financial pressure, they lead directly to lower quality care for everyone. And that, in turn, can create higher risks for patients, and ultimately, it widens the health inequalities that already exist across our entire population. It's a ripple effect that touches every single one of us. This really forces us to ask a very basic, fundamental question. What is the goal of our healthcare system? Are we intentionally designing it to promote healing and well-being, or have we accidentally created a system where everyone, doctors and patients alike, is just trying to survive? Recognizing the problem is the first step, right? So now let's turn to the path forward. How do we even begin to reclaim healthcare for its true purpose? Real reform isn't just about changing a few policies here and there. It really starts with people. It requires a system where doctors can have a sustainable career, where patients feel empowered to advocate for quality care, and where our communities start to recognize the invisible pressures that are at play. Ultimately, solving this is about getting to the root cause. It's not about blaming individuals, it's about making those invisible financial pressures visible and then dismantling them so they stop warping the whole system's incentives. And we'll end on this thought. Meaningful change in public health only ever happens when we, as a society, find the courage to see, to talk about, and to finally address the problems that have been hidden in plain sight all along.